رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان.
Assalamu alaikum, welcome to the Health Show, a coronavirus special which is live with me, Alistair Greener. Now again, today's programme is going to include taking your calls, which will be answering questions from an alternative viewpoint. If you'd like to call in, you can do so by dialing 0208 554 2514, and the phone lines will be open very shortly. Now, if you can't get through, or if you'd like to send us an email instead, our email address is healthshow@islamchannel.tv. That's healthshow@islamchannel.tv. Now, let's take a look at the latest updates of COVID-19. As of a few days ago, the UK started to add deaths that have taken place in nursing and care homes, as well as hospices and the community. Now, this meant that there was a very sad rise of more than 6,000 recorded deaths caused by COVID-19 in the last 5 weeks. Now, death tolls each day include all of these places, and yesterday's total was 621. Meanwhile, Boris Johnson, the UK Prime Minister, announced that the UK has now passed its peak. However, he added that with daily deaths of around 600 to 700 a day, the UK is still very much in lockdown. The UK has now surpassed more than 28,000 deaths from COVID-19, and currently there are more than 182,000 people with the virus. I'd like to welcome back our weekly guest, General Practitioner Dr. Imran Gohar, and joining him again today is Ustada Sidra Naeem, who's a Muslim chaplain and alama. Welcome back, both of you.
Thank you.
Good to see you. And again, as usual, we're observing the normal distances, as is everyone else here in the studio. So good. I'm sure we're going to get lots of calls again today. So thanks for being here. Now, it's always a pleasure having Sidra Naeem joining us on the Health Show, and especially with her being a teacher specialising in special education. Here she's going to take a look at 5 ways of how you in the home in these unprecedented times can interact with your children. Let's take a look.
Assalamu alaikum, I'm Sidra Naeem. I am a qualified teacher. Today I am going to give you 5 tips on how you can cope with your children during lockdown. Number 1, stay calm. There's a lot of anxiety out there, especially amongst mothers with this coronavirus. If you feel anxious, the children will feel anxious. So we need to stay calm and then relay that calmness onto the children. Number 2, the madrasa have stopped. We can reenact all the madrasas at home. This is your chance really to gain some sadaqah jariyah. So all the activities in madrasa you can now do either online through the teachers who are doing online streaming, or you can download so many Islamic activities through the internet and do those with your children. Keep the Islam up, especially in Ramadan. Number 3, the mosques are shut, so we're not doing any prayers in the mosques at the moment in Jamaat. But don't fear. Do you know what? You can do those prayers in your own houses. Why not get the children involved to lead the prayers, and the whole family can bond together as a family and do all the prayers together in Jamaat. Number 4, get your children engaged in lots of other activities. How about board games? There are so many Islamic board games out there. Play them. That is doing, again, the Islamic side, and you're bonding all together as a family as well. Also use your children for cooking. At the moment it's Ramadan. Why not use your children to come into the kitchen and help to prepare the suhoor meals and also the iftar meals as well. Number 5, We need to build up the immunity of our children, not just for the coronavirus, but for all other future diseases and colds and flus and everything. So there is a new acronym out there called New Start. And let's start off with all the letters. N stands for nutrition, so we're looking at fresh fruit and vegetables. Get your children to cook more fresh fruit and vegetables. Then we've got E, exercise. Take them out for a walk. 1 walk a day will give them their exercise. They're also having their exercise through praying as well. W, water. Fresh water is best to hydrate themselves. And again, we are naturally cutting out on fizzy drinks and sugary things in Ramadan as well. S stands for sunlight. When we take them out for a walk, they will naturally get their sunlight out there, which helps to build up your immunity system. T is temperance. We are limiting bad things like sugars and processed foods and caffeine. Then we've got A, which is air, fresh air. You're doing that anyway when you go out walking with them. R is plenty of rest, plenty of sleep. Having said that, they do need a good routine, so they need 1 sleep time. And then we end with T, which is your trust in Allah. Allah brought this virus to us. Inshallah, Allah can take this virus away from us.
That was really, really helpful, and I'm sure will be helpful for lots of people at the moment, you know, going through Ramadan and, you know, maybe a little bit of an extra stress as well with that. Now, we're going to be talking about Ramadan in just 1 second, but I want to begin, Doctor, if I may, with just maybe some of the latest updates. You know, we've had a lot of talk about masks, the use of masks, and not only by the Mayor of London, Sadiq Khan, but also from the government. And also we've seen other countries, you know, are starting to talk a little bit more about the mask. Eurostar, for example, saying that everyone has to wear a mask if they're going on Eurostar. So give us the latest medical evidence and the latest thinking about masks.
Absolutely. If you recall, in the first show, we were having this talk about mask, and when there was a lot of queries about whether should we wear a mask, and a lot of people were saying there's no point of wearing a mask, and somebody asked a question, and I did mention that I think it's always better to wear a mask than not to wear a mask, because the logic says at least you're not coughing and spreading the germs as you can without a mask. So now they have come to the conclusion, and everywhere they're saying that a lot of places they're making it compulsory to wear a mask, which makes sense actually. I don't get into the debate of what kind of mask you should wear. Obviously, for healthcare professionals who have more exposure, they need a FFP3, which is the highest quality mask to prevent coronavirus. But for anybody who's going out, I think wearing a mask is a barrier, inhaling the viruses, and of course spreading the virus as well, because as you know, a lot of people are silent carriers. They don't get symptoms at all, and you don't know if you're going to shopping if they have virus or not. So at least those people who are silent carriers, they can, which are 80%, they can be prevented to pass on the virus to others. So obviously there's a huge inclination towards that now. People have realized that mask is very important, and I think it's going to be implemented throughout the country.
And we're probably going to see more announcements. I believe from the Prime Minister was saying that we can expect quite a few announcements regarding the lockdown and masks and things this week. And of course, Sidra, we're in the middle of Ramadan, and for a lot of families, it's an opportunity to refocus on their faith. But you know, there's quite a few questions which are coming up that we've had on email throughout the week. One is about, you know, if you are suffering from a coronavirus, you know, do you still need to fast? Then talking about the Tarawih prayers as well. And one or two people, and I think they've mentioned it as well here on the show, talking about the du'as as well, maybe something special for Ramadan. So quite a lot in there for you.
Three things there. Okay, the
yes.
first one is if you do have coronavirus, some people will have coronavirus and not show any symptoms at all. In that case, you can fast. If you're showing some symptoms, but they're mild symptoms like a normal flu symptom, you would do what you would normally do. So do you normally fast if you have a mild flu? If the coronavirus symptoms are a lot more and you need a medication throughout the day, then in that case, you do not need to fast. You can make up for the fasts afterwards. Okay? The second one was, what is the best dua that you should read if you have the coronavirus? If we look at Prophet Ayyub alayhi salam's story in the Quran, he was one prophet that was afflicted by illness, and there is a dua in chapter 21, which is Surah Anbiya, verse 83 in the Quran, where Prophet Ayyub calls out to Allah, you have afflicted me with this illness, please, you are the most merciful. So that is the one to read there. The third question you said about Tarawih prayers, we should read those in our houses. And the imam who is leading the prayers, even if it's the leader of your family, needs to be in the house. You cannot read across social media. It's the same kind of ruling as Jummah prayers. So the other thing is that you don't have to finish the whole Quran in Tarawih prayers. At the moment, there may be somebody just in the house who can read a few surahs of the Quran. In that case, just continue reading in that way. That is absolutely fine. You can still read in Jamaat in your own house as well.
Thank you so much. Wow, great. Covered a lot of ground there, and I know that a lot of people watching will be really grateful to have that clarity. And again, while we wait for some calls to come in, feel free to give us a call when you're ready. I just want to look at some of the figures again this week, Doctor, because, you know, again, the UK seems to be one of the highest countries, and one of the saddest things is that the Black, Asian and minority ethnicities seem to be suffering more, and there's a lot of talk around what's known as the BAME community. Why is that from a medical point of view, do you think?
I think there are a couple of things. First of all, there are a lot of this community is attached to healthcare work. For example, doctors, nurses, healthcare, the nursing staff, HCAs, and the carers as well. So of course there's a huge exposure as well. The other thing is in this community, after a certain age, we have high prevalence of diabetes and other illnesses as well. And I think people who got these problems are getting the virus in a worse shape actually. So that's my opinion. I don't know genetically and other bits and pieces, the research probably going to be done later on. But at that moment, that's how I feel that these communities, they're exposed more to the high-risk people, and that's probably why they're getting more. And also with the pre-existing illnesses, that's making it worse.
Brilliant. Thank you so much. And we're going to talk a little bit about, you know, trouble in home in a moment. But first of all, we have a call from Danish in London. So a very good afternoon to you, Danish. What would you like to ask?
Yes, good afternoon to you. I would like to ask two questions from one question each from your expert. And the first thing that I want to ask and perhaps add is that the mask should have been worn at all times. I do not know what was the big logic in not wearing masks when it is so simple, and as the doctor said, it prevents you throwing up viruses if at all you are carrier or you're not carrier. So why was this decision it did not come from the WHO from day one? What was the big deal? I want to, this is doctor or yourself might answer, but the other question is from the lady who mentioned about the Prophet's, something regarding Prophet Ayyub's dua or something. What I wanted to ask is, why can't we make it very straight and simple for nobody to be in confusion that we should not go to mosques for Tarawih, for Jummah, just like the rest of Saudi Arabia has done, rather than trying people come 10, come 15. Why could we not make it very straight? What's the big deal? And number three, why is it that in India, Pakistan, the death ratio per million is 1 to 2, whereas in America it's 300, and in UK it's about 148 or something, close to that. What's the main difference where those Asians working here, they are, there's so many deaths happening, but not in India, Pakistan, where the general hygiene and everything is
okay,
so
thank you very much.
So much.
No, thank you so much. A lot in there, and I'll come to you, Doctor, in a second with the question about Pakistan and also the masks. But first of all, maybe Sidra, if you would like to address the one he was talking about with the duas.
Yes, I mean, he mentioned about the Tarawih prayers again, didn't he? It's crystal clear. The mosques are shut. The ruling in Islam is that although Jummah, for example, is fard and the 5 times prayer is fard, if a bad overrides the good, in this case, killing one person is like killing the whole of mankind. In that case, then you do not go to the mosque, and it is good that the mosques are shut. You can do those fard salahs at home. Taraweeh is not fard. Taraweeh is actually a sunnah, so you don't even have to do it. But some people feel their Ramadan is not complete without doing Taraweeh. In that case, then they can do them at home, within the house, whoever's in the house, whoever normally leads the prayers. And I made that crystal clear. You do not need to be a hifz of the Quran in order to do Taraweeh. Even if you know a few surahs here and there, you can still lead Taraweeh and do them at home.
Okay, thank you so much. Now, interesting enough, we talked about masks just before Danish called in there, and you know, there's a logic we understand for wearing them. However, his question was, why weren't we doing this beforehand? What's changed?
Well, I think that's what I'm saying for the last 6 weeks, actually, wear mask. And I think we always try to get evidence about things, and evidence takes time. Sometimes you need to think logically, okay, how logical it is to wear a mask for a respiratory droplet related illness, you know, when you cough or sneeze, which is mainly the route of transmission of this disease. So it's pretty logical actually to do that. But I think in the beginning everybody wanted a kind of I don't know, it's a mental barrier for people in this country. They were thinking, you know, too much about how we're going to look like or whatever. I don't know.
Do you think some of it might have been because they didn't want to take those masks away from where they're really, really needed? For example, we found that in Germany last week, didn't we? That there was, you know, the general population were told to get masks, and all of a sudden the medical professionals who needed them desperately suddenly had their supply cut short.
I think the supply issue for the mask, which is healthcare professional needed, was an issue. And I think for the general public, you don't need that mask actually. I think general public should. It's that again. It's my opinion. If they would have worn a mask from the beginning, maybe we wouldn't have that much of a surge. Look at the countries like Korea and other places where it's quite normal to wear masks. Japan and they have less of a spread than us. So again, a speculative comment. I don't know exactly. The time will tell. But the logic was from the beginning for illnesses like this, which is flu-like illness, which is spread by coughing and sneezing. It's logical to wear a mask.
And what about the difference in figures between countries? We talked about the fact that care homes are now being included in the UK, which of course has moved our figure up. Yeah. I haven't actually read much about Pakistan. What's the story there?
Do you want me to answer that one?
Sure, yeah. Well,
I've looked into this one, and did you know that the figures are lower in India, Pakistan, Bangladesh because of curries, believe it or not? So we put a lot of garlic, ginger, turmeric, black seeds, kalonji seeds and chili in our curries, and they're all antibacterial agents. And that's what the theories have been out there.
Wow. Okay.
And the one danger which we are observing on the ground now is recurrence actually. Patients who are getting once, they're probably getting again as well. Again, they're high-risk patients and they're not very old either. So let's see how things pan out. So we are testing them again now because they have had the virus last month, but they are again showing the same symptoms. So we're in the process. Maybe in a few weeks' time we'll learn whether there's a research of the virus.
And of course, in every country, there's a different definition of lockdown as well.
Yes.
New Zealand have, which seems to me to be the best one that I've heard so far, where they have a stages of 1 to 5 of what each level of lockdown is. And I think maybe the UK government are talking about giving that information to us maybe this week of what their system is going to be to, allow the lockdown to be eased. But there's a danger here, Doctor, isn't there, that if we ease the lockdown too soon, that actually we'll get another spike. So I guess we're watching other countries to see who have started to ease it, what happens there.
As I mentioned earlier, that we are seeing resurge of this infection, and patients who have had the infection in the past, in a month or 6 weeks ago, they're getting the symptoms again. Now, these patients are under the process of retesting again. So let's see what the report comes. But if it shows they're reinfected, it's quite a dangerous trend then, because we are assuming till now that once you have had the infection, you get immunity and you don't get it again, or get it very mild.
What about the other reports that are out there that, you know, with summer coming on, it will naturally sort of tail away a little bit, but then we should be really, really worried when it comes to next winter, when it comes to October, November time, there could be a resurgence, because certainly some of the warmer countries in the southern hemisphere seem to have been less affected than us in the northern hemisphere. Is there any truth behind any of that?
Well, majority of the respiratory infections like influenza and COVID, they spread during winter time. And also, I think in Western and cold countries, one of the reasons is that we live in a very close environment. There's no ventilation in the room, in the house. There's no fresh air. So it flourishes very well, actually. And as I said before, 80% of the infection is within the family. You spread within the house. So that may be one of the reasons. And as you said, we don't know. I mean, we may get a research again in this winter. I hope not. But hopefully, till then, we'll have a vaccine.
And of course, the good news between the very early days and now is the fact that we've got more sophisticated testing, the fact that testing's happening more often. Back to the Health Show, a coronavirus special, which is live. And I'm joined again by Dr. Imran Gohar and Ustada Sidra Naeem. Now, Sidra, one of the questions we did get coming in from email was talking about domestic violence, whether that be emotional or physical. And that comes on the back of the government recognising in the UK how important that is, because they've pledged another £76 million to help people who might find themselves in those circumstances. You know, as a chaplain, you must be getting quite a few calls.
Yes, domestic violence is on the rise at the moment because everybody's in lockdown and you're in close proximity with the family, whereas at other times you'd be going to work and you'd get away from these kinds of things. So it's not just physical domestic violence that we always think about when it comes to domestic violence. It's other things like emotional abuse, controlling behaviour, toxic relationships. All of that is on the increase at the moment. And the message out there is you still need to continue with all the counselling sessions that you normally receive. All the counselling is continuing over online, internet, and also through
because
telephones.
Some people might have that assumption that because everything's locked down, those charities and all those people offering help might not be able to do it. But you're saying they are still very much there.
They are still there, and it's very, very important to talk. It really is. It's no good bottling up all your emotions. You need to get away from that person, go into the garden. I had this question, how can I talk about my wife when she's actually in the room? Go to another room. She can't stop you going to another room. Go into the garden, go in another area where you can speak. But it's no good bottling up your feelings because mental health then rises.
The main message here is there is still help out there,
There is.
and please do get that.
Yes,
Excellent.
do use it. Do
Excellent.
use it.
So again, coming back to you, Doctor, what are the sort of the questions that you're getting at the moment? Because, you know, most of us feel actually we have got a lot of information. We do understand the message, stay at home, you know, be aware of symptoms and things. But what sort of things are coming through to you still?
Well, we're still getting a query about the symptoms. For example, patients are still ringing about, I've got a sore throat, I've got symptoms of COVID, with fever, without fever. Do I have a COVID? And the other thing which we are getting is research, patients who are being discharged successfully home, and they are getting symptoms again. That's the second category. The third category is the patients who are suffering from other illnesses, especially patients with, you know, query cancers, patients with small, minor infections and things like that. They are on rise. Especially the elderly who were getting very regular visits from doctors, or they used to see the nurses quite regularly. Obviously, they have ongoing health issues, and they're piling up basically. So they were not ringing for the last couple of weeks, but they have to now. And so we're getting all sorts of calls regarding the COVID. As I mentioned, what making me worried now is about the research patients who I hope they don't get reinfection, but there's some queries about...
And we're seeing some of the other hospital services which were put on hold because they were anticipating, let's be frank, even greater numbers than we've tragically already have. They were expecting even more, but because it hasn't got quite that bad, and because the numbers seem to be on the wane as well, are normal operations and other services starting to resume again, or is it still too early for that?
It's still too early, but yes, we're planning to resume services because life cannot carry on like this. There are a lot of patients who need help apart from COVID as well. People are realizing it now. And I think slowly and gradually we are working differently, obviously, more phone calls, more video consultations, and also we are triaging more patients and we are bringing them in if we feel that they are low risk for carrying any COVID symptoms. So we are bringing them in the surgery as well. So we are gradually increasing the entrance of the patients into the hospital. And I think I was talking to somebody and they were saying that they are probably next week or two they are planning to restart the regular operations as well, because don't forget, I mean, we are in lockdown for 5-6 weeks now, and that's a long time. There's so many people, absolutely. And it's going to be really difficult for the doctors to catch up as well and the surgeons to catch up as well. And it's not fair with those patients either, actually, who are suffering because of other illnesses. For example, I have patients who had fall and quadri fractures, but they're sitting at home and not going to the hospital because they're scared. But fortunately, we have more video consultations now, so I can see that, there are, and we are encouraging them to go to hospital and explaining it to them.
So good news that hopefully that will start to
gradually
improve. Sidra, we're obviously here in the middle of Ramadan. You must be getting lots of questions as an ulama, as a chaplain, as well as your work in education. During Ramadan, what sort of questions are you getting that people really want to know about how to, make the most of this rather different Ramadan than normal?
Yes, I think the main question I've been getting is about the fasting, which we've covered, and the Tarawih prayers, which we've covered, but also how to support their children. There are so many mothers out there who are actually very worried because they've got special needs children at home, and their respite care really for themselves is when the children go to school. So that's the worry, is how do they support their children who've got autism or any other special educational needs, which I'm guiding them with. But again, there are so many online apps. There is so much support through the schools. The schools are giving work every day, 9 till 3:30. Use all of that support, and routine is very, very important. A lot of mothers are waiting till lunchtime to wake up their children, and they're actually wasting half a day of their schooling. So you need to stick to the same routine as schools, get them dressed, ready, as if they are going to school, so they're in the right frame of mind. 9 till 3 should be their schoolwork, and then after that continue the madrasas. You normally send them to madrasa, continue that again online or yourself.
And it's interesting actually talk about routine and things like that. For one of the concerns, and they've been talking a lot about it this week, about getting the schools open again for some children, is because of the most vulnerable people in our society and those families where maybe those children aren't getting that parental guidance and parental help that you've been talking about.
Yes.
What's the situation there, do you think, when it comes to those people in our society who are really, really struggling at the moment, maybe because parents have low level of education themselves, maybe they don't quite understand how to do some of these things. What sort of help is there for those people?
The help at the moment in the schools is with special educational needs. Children who have got EHCPs is the legal document. They can go to school. So there are key workers in school helping those children with severe special educational needs. So that's what is actually happening at the moment. In the next couple of weeks, the government is rethinking their strategy, and they are thinking of sending some of the younger children back to school. There is a lot of schooling being missed at the moment, and as a teacher, I know that it's detrimental actually to their education. Mothers cannot provide the same kind of support than a qualified teacher can do. So they are thinking of sending them back in waves.
And of course, one of the things we want to make sure is that these waves, does pay attention to what the numbers are, because we really, as you said before, we don't want the resurgence of more cases. If you were talking to Boris Johnson right now and the other health professionals that he's listening to, what sort of advice would you be giving as a GP from what you've seen in terms of ways to make sure this virus doesn't come back on a second wave?
Two things. This is a virus which is affecting the whole world, first of all. So first thing I would advise is to learn from people around the world, what they're doing, and what their data shows. That's one more important thing. The other thing is to speak to the foot soldiers, people who are working on the ground, doctors, nurses, consultants who are dealing with these issues, so that they can give you up-to-date advice as well, what the trends are, because it's ever-evolving situation right now. You speak to the people who are on the ground, like I said, I'm seeing research. So it's ever-evolving. Things are changing on a weekly basis. So if nobody knows how it's going to react, and I think that's the best way to make a decision. It should not be a political decision.
Well, we'll pick up on this in a little while, because I'm sure this is going to be something that we're going to be looking at a lot over the next few weeks. But in the meantime, we do have another call coming in, and don't forget you can call in any time. We've got Anna from Morocco. A very good afternoon to you, Anna. What would you like to ask?
Assalamu alaikum. I'd like just to ask you with regard to Ramadan, and I know that Ramadan is a time for rejoicing with the family, for iftar, and it can be very, very hard now to have Ramadan done when everybody is confined on their own at home. I mean, if there is a family they are together, but I'm thinking about other people who are on their own. So do you have any kind of advice or anything that could be brought up to those people, to be able to kind of go through Ramadan with joy and reflection and yeah.
Thank you very much, Anna. I really like that question, because there will be people. We think about Ramadan, we think about it being a family celebration, a time for the whole family to be involved in the prayers and the fasting and breaking the fast and so on. But there will be people who are by themselves during this time. What kind of support is there for them, and what kind of advice do you have for them?
So the best advice really is, why don't you at the time of iftar link in with your family through online media? So things like Skype and Zoom and FaceTime, where you can actually see them and you can see each other's food and you can talk. It's better than nothing, isn't it? So that is the best advice, really, and the only advice we can give, really, at this
And actually, it's
time.
quite amazing, isn't it? When we look at technology, we've all become technical experts now, haven't we?
Yes.
We're all doing Zoom, we're trying to get the lighting right in this. And actually, I don't know about other people, but certainly within my family, we are probably in better contact now than we were beforehand, because everyone was so busy with their lives and getting on with that. But I know as a GP, you get affected a little bit by mental health. You will have mental health people coming through the door, and I know obviously, Sidra, you're very much involved in that. What sorts of things are you seeing with people's mental health coming through the door?
Oh, we are seeing loads of queries about anxiety and panic attacks, loads.
Yes.
And not just patients. So don't forget, already in a normal circumstance, almost 20% of our workload is mental health related, especially anxiety and depression, which we quite successfully deal at primary care as well. But due to this pandemic, we have seen a sudden surge. And the sudden surge is not on existing patients, obviously they are, but the new people who were absolutely fine, had no mental health issues before, and they are unable to sleep, they're getting anxiety attacks in all shapes and forms. They're otherwise absolutely healthy. They will call you for random aches and pains and symptoms. And at the end, when you take a detailed history, it sounds like anxiety attacks which they're getting.
Definitely, and there's no future events for them to look forward to. A lot of mental health gets better when there's good events in the future to look forward to, and the whole routine's gone. And routine is so important when it
I think
comes
one
to
thing which I
mental health.
find quite useful actually in dealing with that is being honest with patients. We don't have any magic pill to sort out the situation, unfortunately. And I think my advice is always that, look, we are all in the same boat. We are all anxious about this situation, but we are all managing. And one of the patient, she was very anxious about doom and gloom situation. So I said, look, I'm coming to work. I have a family, but I'm still coming every day. So I'm on a much higher risk than you. So it reassures people actually a little bit when they see that everybody is going through the same scenario, and people are. You have to strategize yourself. You have to come out how it will work for you. How can you do your normal activities in
And it
this
is very
situation.
difficult, as Her Majesty said, there will come a time when this is over. She said we will meet again and so on. But for some people, Sidra, it's really difficult to see the other side, especially when you hear some, as you call them, doom and gloom merchants who are saying,
Yes.
life isn't going to get back to normal for another year and
Yes.
things like that. I mean, that's not very helpful for someone who's
Yes.
really struggling at the moment.
There's so many verses in the Quran, with hardship comes ease, does there not? And it also tells you that Allah has sent a cure for all diseases, and that kind of stuff. Those are the kinds of things we need to look at. Put your trust in Allah, this is a religious point of view. All these things help you. And at the moment, the whole world, no matter what colour, what religion we are, what creed we are all in the same boat.
And again, I want to come back to Ramadan because it's such an important time of the year, and this is not like no other Ramadan anyone will have experienced before. Again, you talked about the du'as that's special for coronavirus and people suffering from that at the moment. But what other extra things do you think people could be doing, given the fact that for a lot of people they do have a bit more time?
Yes.
They're not rushing back and forth trying to cope with everything during Ramadan. Actually, having that little bit of extra time does have its own advantages.
Yes, it does actually. With the Tarawih prayers, because some of Tarawih prayers are not happening, the Tarawih prayers actually complete the whole Quran in Ramadan. Ramadan is an anniversary of the Quran being revealed. So what people can do if they're not reading Tarawih prayers is to read the whole Quran in Ramadan. They can read it with translation or they can read it in Arabic. And like you said, they've got more time during the day, but we mustn't do any time wasting activities. So we need to do as much ibadah as we can, because did you know the reward is 70 times more in Ramadan of doing good deeds. So as much good that we can do, we should try.
And that's a really, really valid point, isn't it? Because everyone's going out every Thursday evening, applauding our carers and key workers and showing appreciation. But actually, there's a lot of place here for people to actually help one another, to consider one another, to think about the neighbour, think about the person who's alone, and to really reach out to those people.
Yes, shopping is a big one. So if you're going out, for example, to the Asian shops, so whenever I come here, I go to the Asian shops, do my Asian shopping. There's a lovely lady on my road who's not coming out because she's vulnerable. I ask her, what shopping would you like? And then I take the shopping to her. If you've got older, people on your street, ask them what shopping would you like, because they are not IT equipped. They're not into internet. They can't do online shopping. So the only way really to help them is to take the shopping to them. You can leave it outside their door. There are ways.
And it's so important, isn't it, that communities, continue this coming together. What sort of changes do you think are going to remain from a medical perspective? What kind of things do you think are going to remain in place for quite some time yet?
Well, I think the social distancing would remain in place, in my opinion, until we have vaccine. And I think as Sidra mentioned, I think there are a lot of positive points as well, actually. Now, when it has come to us, don't forget, our NHS is government-run organisation, so we are running in a very traditional way. And now people are thinking out of the box. And that's a very good thing, actually. For example, we are using video consultation, we're using phone more, and patients are also actually realizing that in some occasions they used to abuse the system as well, actually, and clog up the appointments. And I think that's something people should, I hope, learn. Especially this cough and cold. This virus should wake people up, actually, because from primary care point of view, on a daily basis, this cough cold used to be like 15 to 20% of our workload. And people with this virus, one thing they should learn is it's a virus, and it's there is no treatment apart from doing certain bits, and that should just cure yourself and actually build your immunity.
Yeah, really, really good advice. We've got one more call. We've got Cameron from Lakeside, which is there in southeast London, I believe, or in Kent, isn't it? Good afternoon, Cameron. What would you like to ask?
I wanted to ask is, do you think the virus will still be lingering around for a few years, or do you think we will be coming to the end of it?
Wow, there's a big question. If only we all knew the answer to that one, Cameron. Doctor, I've got to come to you on that one. We were talking just then about the long-term view of this virus. What's your perspective?
So any virus can linger on if you don't basically get any vaccine against it, or either you have your own immunity against it. So as far as the virus is concerned, if there is no barrier to it, it will carry on basically. So either we will get immune to it, or we will create an artificial immunity in the shape of vaccination. And
what's the latest news on the vaccine?
I think it's still in the process. I think the time scale is still probably end of the year or earlier next year. But still it's a long process, and I think, but they are progressing well. I think the other test, which I mentioned in the program previously as well, is the antibody test as well, which can be quite a good one. I'm hearing that it may come out soon, which at least this 80% silent carriers we can find out, because if we know somebody already have had the infection, then at least they have some immunity, and then there are lessons to be learned as well from those people. So as far as the virus is concerned, I think it's going to stay. I don't know about 2-3 years, but looks like at least the end of this year. But again, either we'll have vaccine for it, or we will get immune to it, and hopefully that's how it's going to go down.
Thank you. And Sidra, I just want to come to you in terms of, because we're coming towards the end of the show, and bringing the focus back to Ramadan, and this is a time when people are focusing on their faith. What kind of message would you give to people in the long term? Ramadan will come to an end. There will be the normal lockdown life as opposed to Ramadan lockdown life. What kind of advice would you give to people, to see this through?
Put your trust in Allah. Think of all the good things. You've all become humble. You've gone all down to basics. People are home cooking at home. The restaurants, the cinemas, the theatres have all gone. Think of, basic life is happiness, isn't it? You're connecting more with your families, are you not? You're closer with your families because you're more at home. All of that is a good thing. More unity. We're also ringing up our old friends more, are we not? Getting in touch with old friends and things, seeing how they are. I think humanity has been brought back with all of this. The other thing is, if you did suffer from the virus, every illness expiates sins in Islam. So think of all the sins that are falling off you while you're suffering with whatever, Allah has given you.
Brilliant. And final thoughts from you, Doctor?
In my opinion, I think feeling doom and gloom is a natural phenomenon. We all, somewhere along the line, feel like that. It's going to be life. I say, everybody feel like that. But what we need to think is positively. How can we deal with this pandemic positively? What can we learn from it? And how can we carry on our routine differently? And I think that's a frame of mind we should wake up with and try to implement it slowly. If we're going to keep on talking about it, if we're going to keep on worrying about it, I think that's not going to solve our day-to-day problem. And what's going to happen, the virus may go, but we will, have some other serious issues in mental health or physical as well. So I think positivity, think differently. You have to accept it. It's a fact of life. Think differently and try to move on as much as you can.
Brilliant, and great advice from you both. Really, really do appreciate that. And hopefully, having seen the peak passed over the last week, that hopefully, we are at a point where we can see the light at the end of the tunnel as well. So it's been really great. So thank you both so much again for all of your help. We really, really do appreciate it. Thank you. Unfortunately, that is all we have time for, though, this week. I'd like to thank our guests, General Practitioner Dr. Imran Gohar and Sidra Naeem, who's a Muslim chaplain and alama. Join us again next week, and please stay safe. Goodbye. Last week they were queuing